Here talking to our doctor today, who's here to answer your questions, talking about a pregnancy and some of the crazy myths and things that old wives' tales that you hear about. This is Dr. Talia Gates. She's an OBGYN with Walker Baptist Medical Center. Good morning.
Morning.
It's good to see you.
You too.
So as we wait for the calls to come in, 741-9272, do you have a question about pregnancies or some myths that you've heard about it? And while we wait on those phone calls to come in, so our producer, Vanessa, she asked me to ask you, so if you've, like I only had pregnancy-induced heartburn, never had heartburn otherwise. So the old wives' tale is that your baby's growing hair if you're having heartburn. Is that true?
It's not. Heartburn is just a known side effect of pregnancy. I've had lots of patients that say, this baby better have hair with as much heartburn as I've had. But it is just an old wives' tale. It's just caused from the mechanical obstruction of that uterus growing and not letting your food go down as well as it should.
Well, you do have a person growing inside of you.
Yeah, they're in the way. They're in the way.
Yeah. So my little boy, Noah, I did not have hair till he was almost a year old. So, and I had a little bit of heartburn, but not a lot.
All of my kids had hair, and I had heartburn in only one of my pregnancies. So you know, go figure.
All right, let's go to Portia. She's on the line. Hey, Portia, how you doing? Hello, Portia, you there? Somehow we've lost Portia. I can hear her moving around.
Hi. I cannot believe that I'm the first caller for the morning.
Well,
hello?
You are. Good morning.
Hi, how are you?
Good. What's your question?
Hello, can you hear me?
Yes, ma'am.
Okay.
Is your TV turned up? I think, are you around your television?
I was calling. I had an ablation back in 2011.
I think she's getting some feedback from her TV, and that's what's kind of throwing you off.
Can you hear me now?
Yes, we can hear you.
So you had an ablation.
Is it possible that maybe...
Yes, she's hearing the...
Is it possible that I might get pregnant?
It is possible to get pregnant after an ablation, but we strongly advise against it. Personally, I require that my patients that I do an ablation on have some sort of permanent sterilization, like a vasectomy of their husband or a tubal ligation. The reason that we don't want you to get pregnant after you've had an ablation is that it can put a dangerous situation where your placenta is adhered to your uterine wall and cause a very dangerous situation at the time of delivery. So we do not advise you get pregnant after an ablation.
Okay, thank you. All right, our next caller is in Anniston. Is it Kelsey? Hello? Do we have our next caller? Sorry, we're having some issues, obviously, this morning. All right, I'm not sure what's going on with our phone lines. We do apologize for that. But if you guys can get our caller in, just let me know, and we'll move on to the next caller. Okay, you guys just let us know. In the meantime, we will talk about what's going on there in Walker County. So what is the most common question that you usually get?
Oh man, it's all over the board, but a lot of people want to know what level of activity they can do in pregnancy. I was thinking about common myths in pregnancy, and it's that you just supposed to put your feet up and just grow the human for 9 months. But actually, you know, it's encouraged to continue to work, to continue to be active. I tell people, you're pregnant, you're not disabled. You can work, you can exercise, you can do everything you normally did before you got pregnant.
But we do treat, even we do as women, we treat someone who's really pregnant like,
don't touch that, don't lift that.
That's true.
Yeah.
All right, we have Francis on the line. Hey, Francis.
Good morning.
What's your question?
My daughter-in-law was due in October, but she's having a lot of pain in her lower stomach, and they're telling her this is normal. I don't remember that being normal when I was pregnant.
Everybody experiences pregnancy different, depending on how many weeks along you are. So someone in October may kind of fall in that. You can have this thing called round ligament pain, and the ligaments that hold up your uterus can actually get pulled as you turn side to side, causing sharp pains. Also, you can have a lot of pregnancy in your lower abdomen just from the pressure of growing and carrying a baby, especially after multiple pregnancies. Those ligaments and muscles get more and more stretched out, and so you can just continue to have kind of pressure and pain down there. But if the pain is worsening and it's not controlled by the things that they've told her to try, she definitely wants to always check with her doctor.
All right, thank y'all. Have a blessed day.
You too, hon. Sounds like she wants to make sure that grandbaby's all right, and the daughter-in-law. All right, let's check in now with, I'm so sorry, what did you say, Vanessa? Hey, Veronica, how are you?
How are you?
Good, good. What's your question this morning?
Yes, I'm a diabetic, and I'm taking a certain drug that may cause yeast infection,
Uh-huh.
and it does.
Okay, yes, ma'am.
So they gave me metronidazole because the the other
Yes.
stuff didn't work.
Yes.
But it made me sick.
Oh, it made you
I'm
sick.
wondering what kind of food, what kind of foods can you eat, to counteract that?
Okay.
Well, increasing anything with probiotics in it, like yogurt, or you can even take an over-the-counter probiotic, can sometimes help with the yeast infections. But really, you should talk to your doctor that prescribed that medication and tell them that that's the stuff that you're having. You can also take your medication with food, and sometimes that'll help decrease it making your stomach upset as well.
Okay. Thank you.
Good luck,
You're
hon.
welcome.
All right, that's our last call for today. Dr. Talia Gates, thank you.
Thank you.
It's good to see you.
You too. Have a great day.
All right, now here's Jay.